So I would like to separate between two things: susceptibility to the infection and severity of infection. In reality, we don't have any research to show that people with cardiovascular disease or obesity or diabetes are more susceptible to the infection. But if they catch the infection, the course of the infection will be longer and the complications will be higher. So susceptibility is the same, but if the infection occurs, it will be severer in those people with cardiovascular disease, obesity, or diabetes. I think we are forced now to try in full-fledged, I will say, telemedicine. Currently, we are doing phone consultation, but I think in the future we also will do video consultation to be a complete telemedicine. I think there is a lot of adaptation going on right now, some relaxation of the HIPAA regulation, some speed in making more regulation that will enhance billing using insurance billing code for phone visits. Even Medicare is adopting now the phone visits, but no more than 10 minutes. But others can accept it up to 30 minutes. So it looks like the era after COVID-19 virus will be different from the era before that in the relationship or how the communication will be between physician and patients. Technology will be used more often in the future. This is actually the most important question that you asked because people around patients with diabetes should be very, very careful, especially if the patient with diabetes is in old age, more than 65, or the person has other cardiovascular problem or other chronic health problem, because it is extremely dangerous. So people around them should apply the extreme precautions in dealing with them. If they are out, they have to be very careful. They have to clean their hands very, very well. If someone get infected at home, that person should isolate him or herself in a separate room. They close the door on the room, use separate bathroom, and cover their mouth and nose with mask all the time. And the cleaning method should be very careful and don't come in even approximate distance with anyone with diabetes. It is better that if someone caught infection in the home, that the person with diabetes will move to some other place. It will be safer for them. You know, as they are at very high risk for complications from this infection, they have to be very, very careful. In my personal opinion, I usually advise people with any chronic medical conditions or people on immunosuppressive medication to stay home. Not even go outside for any reason unless it is absolutely necessary. So catching an infection, and mind that catching infection can occur from people who are not symptomatic and they may think that they don't have the virus. So they have to take extra precaution. And when they are back home, they have to use all the self-cleaning method with the soap and water, and also they can use any sanitizers with alcohol more than 60%. But they have to be very, very, very careful not to catch the infection. Yeah, it affects it significantly. As I mentioned, the course is a severe course, and blood sugar can shoot up significantly high. So in that scenario, uh, people usually don't understand that when they get infection, the blood sugar will be very, very, very high. And because people sometimes feel some nausea or loss of appetite, they don't eat, they don't take their medications. In reality, medication should be increased, and especially insulin should be increased for patients who are treated with insulin, either type 1 or type 2. In severe cases, when they are in the ICU, we are suggesting now that people may use CGM, although CGM may not be perfect because of hypoxia and because of reduced perfusion, but at least it will reduce the contact time while they are using insulin infusion or they are using intensive insulin therapy. So definitely people with diabetes need extra care. I will suggest for anyone with diabetes to test more frequent during this period. If the blood sugar is high and they have type 1 diabetes, they should check their urine for ketones and keep ketone strips all the time available because the possibility of developing diabetic ketoacidosis will be significantly higher in patients with type 1 diabetes.